Good morning, everyone. My name is Ted, and welcome to yet another video from Ted Says. Please like this video, leave a comment, and subscribe to this channel for more exciting content. In my previous videos, I have been speaking about the hospital setup. Specifically, I spoke about the things that you should do and the things that you should never do whenever you're attending a hospital setup or a hospital appointment, so that you can get the best diagnosis and in turn the best treatment for your condition. In the follow-up video, I talked about the things that you need to know when you're preparing to go for a scheduled appointment for a medical test or to go and give a specimen for medical diagnostic workup. Today, ladies and gentlemen, I want to speak about something that most people have been asking me in my private inbox. And that is, how many ultrasound scans should one do when they are pregnant? Usually, when you learn that you are pregnant and you begin going for your clinics, one of the things that you should put at the back of your mind is that you need to do ultrasound examinations. You need to at least do 3 ultrasound examinations throughout the entire period of your pregnancy. The first scan is done in the first trimester, and the second in the second trimester, and the third, as you could guess, in the third trimester. Now, usually, sometimes some doctors will ask you to do an additional scan just before you deliver or just before you are admitted for delivery. Let me explain. You need to at least do a scan in the first trimester for the following reasons. 1, you want to make sure that the pregnancy is not outside of the uterus. There's a condition called an ectopic pregnancy. It's life-threatening, and it's usually a medical emergency. So you want to do a scan to make sure that your baby is in the right place. Secondly, you want to do a scan to ensure that your baby is actually alive and growing well, what is called viability. If you do not know this in the first trimester, and because you're exposed to many other risks, you might end up losing that pregnancy without knowing. And therefore, having a scan done will be able to trace a heartbeat and probably inform the doctor if there are any problems or any challenges that the pregnancy might face in the first trimester. Third, you want to ensure that you do a first trimester ultrasound just to be sure of how many babies you're having. That is, how many fetuses do you have? Is it a twin? Is it triplets? Or is it one? This way, you'll be able to plan accordingly, and you'll be able to know how to handle your pregnancy along the way. You'll be able to explain the many symptoms that you'll have, like excessive vomiting and also easy fatigability, for example, when the pregnancy becomes bigger. Also, number 4, you want to do a scan in the first trimester to trace for any early abnormality signs. Unknown to most people, you can actually tell if a pregnancy is going to be normal or not by looking at the baby in the first trimester. That is from 0 to around 3 months. There are parameters that doctors look. There are things and features that doctors search for when they are doing this ultrasound scan. And if it is done well, you'll be able to know the chances that your baby will end up not being a normal baby. And therefore, it is beneficial for you, and you'll be able to understand and know what to do next. Number 5, you need to do a scan in the first trimester just to be able to be sure that there are no other pathologies or problems within your pelvis, so that as the pregnancy grows, you are sure and you know that nothing else is going to impede your pregnancy. Or you know that there's another problem that is underlying, and therefore the doctor will want to pay attention to it as your pregnancy grows. Those are just few highlights that I have given to you for the first trimester ultrasound scan. There are many more reasons, but these are the paramount 5 why you need to do a scan in the first trimester. So it's not an issue of the baby is too small, I do not need a scan now. That is the right time to be able to describe so many things that your doctor will explain to you. Secondly, you need to do a scan in your second trimester. Usually, in most centers, they encourage you to do this scan between 18 weeks and 24 weeks. The second trimester ultrasound scan is also known as an anomaly scan or an anatomical survey scan. In this scan, the baby has put on enough tissue for the sonographer or the doctor to be able to appreciate most body parts. This way, the person who is doing the scan is able to describe if there are any abnormalities with your baby, like missing limbs, a cleft lip, or a cleft palate, or even an abnormality of the heart, a missing stomach, or kidneys that are not functioning well. So you need to actually do this examination so that you are sure and you know the parts of your baby are well formed, nothing is missing, and also to inform the decision in terms of when you find something abnormal or wrong. So don't just sit, feel a baby kicking, and you're okay with it. It's important that you do a scan in the second trimester to be able to understand how your baby has formed, if there is anything missing, and if there's anything that you need to prepare psychologically, especially when you give birth to your baby. Number 3, you need to do an ultrasound examination just before delivery at around 34 to 38 weeks. In this scan, what is interesting is that the doctor is able to be given information to decide whether you can have your baby through the normal means or if you will need an elective cesarean section. What do I mean by this? In the scan in the third trimester, the sonographer or doctor is actually looking at the weight of the baby, how the baby is presenting, how well matured your placenta is, and how capable the baby is to survive outside the world by gauging how the baby is breathing, how the baby's heart is working, and how the baby is receiving blood supply from the mother. These are very important information that any obstetrician will ask for, and therefore you need to come for this examination in the last trimester, preferably between 34 and 38 weeks, anywhere along that line, so that you can describe the capabilities your baby has and also decide with the doctor the mode of delivery that you're going to have. This is when you're able to see things like a cord around the neck that is causing serious distress to the baby. This is the time you're able to describe insufficiencies of the placenta. This is the time you're able to describe fully if a placenta is obstructing the pathway of the baby, or if there was any pathology picked like in the first trimester and second trimester, you're able to understand how it's going to affect the delivery. So ensure you do another scan at least in your last trimester between 34 and 38 weeks. Now, there is another scan called a growth monitoring scan. This majority of the time is not paid a lot of attention, but if you can afford and you are able to, it's important that you have this fourth scan, and it is done between 28 and 32 weeks. It is done so that you can be able to know that your baby is growing at a normal rate, and the baby is putting on weight at a normal rate, and the baby is commensurate with the dates that have been assigned to this pregnancy, so that you're able to pick things like a baby who has stopped growing, or any complications of the placenta, or any complications of any fetal abnormalities that might have not been picked up in the previous sonograms. So you want to make sure that you do a growth monitoring scan between 28 and 32 weeks. This is the best time to be able to gauge if your baby is growing accordingly. With those 4 examinations, you'll be able to arrest anything that particularly might affect your pregnancy or might not be good for your pregnancy. So ensure that you do a pregnancy scan at least in the first trimester, second trimester, and then in the third trimester. And if you can and you can afford, please do another one for growth monitoring, which is usually in between the second trimester and the third trimester ultrasound scan. I hope that this information has been valuable to you. I hope also that you can share with those who do not have access to this video. As we all know, we are still fighting the coronavirus pandemic. I urge you at all times, stay safe, stay clean, wash your hands, use a hand sanitizer, observe social and physical distancing, and at all times in public places, put on a face mask. That's it from me today, and have a good day. God bless you.